The mission of the Acoustic Neuroma Association is to inform, educate, and provide national and local support networks for those affected by acoustic neuromas, and to be an essential resource for healthcare professionals who treat acoustic neuroma patients. What is an acoustic neuroma? An acoustic neuroma, also known as vestibular schwannoma, is a slow-growing benign tumor that arises on the 8th cranial nerve, leading from the brain to the inner ear. This nerve has two distinct parts, one part associated with sound, and the other with sending balance information to the brain from the inner ear. These pathways, along with the facial nerve, lie adjacent to each other as they pass through the internal auditory canal. Tumors are typically described as small, less than 1.5 centimeters, medium, 1.5 to 2.5 centimeters, or large, more than 2.5 centimeters. Studies done in 2004 indicate that close to 2 persons in 100,000 are diagnosed with acoustic neuromas. Most patients are between the ages of 30 and 60 years old. Most acoustic neuromas are random, and there is no known cause. In a small percent, 5%, there is an inheritable condition called neurofibromatosis type 2 or NF2, which can lead to acoustic neuroma formation. Diagnosis. The size of the tumor typically affects the severity of the symptoms and treatment outcomes. Acoustic neuromas usually grow slowly, typically 1 to 2 millimeters annually, and the first symptoms are often overlooked as part of the aging process. Typical symptoms include loss of hearing in one ear, tinnitus, or ear noise, loss of balance, or a feeling of fullness in the affected ear. Diagnosis is completed by an otolaryngologist or neurologist using a process that includes taking a complete medical history, an audiogram, and an MRI with gadolinium contrast. ANA offers a booklet entitled Diagnosis, Acoustic Neuroma. What next? It's designed to help the patient formulate questions for their team of experts who will manage their care. ANA members state that their research empowered them to make tough personal decisions and help them navigate the entire process of diagnosis, treatment, and recovery, and help them to achieve realistic outcomes. Treatment. ANA recommends treatment from a medical team with substantial acoustic neuroma experience, although we cannot recommend specific doctors, medical centers, or medical procedures. The ANA website contains a listing of medical resources which is meant as a starting place to begin your search for a physician. Treatment options can be broken down in 3 ways: observation, or watch and wait, radiation, microsurgery. The ANA booklet, Acoustic Neuroma Basic Overview, walks you through treatment options as well as their benefits and risks. No 2 patients are exactly the same. Each patient presents with unique conditions of age, overall health, and lifestyle. Observation. Watch and wait. Observation may be a viable option when the tumor is small, under 1.5 to 2 centimeters. If the patient is advanced in age and/or has minimal symptoms, ones they can live with. With this treatment option, regular MRIs should be part of the program so that you can determine if the tumor is growing. If symptoms progress, radiation or microsurgery are viable options. Radiation may be a viable option when the tumor is small or medium, the patient is older, and the tumor is not pressing on the brainstem. This non-invasive procedure can deliver precise doses of radiation to the tumor to arrest the growth without damaging surrounding nerves and brain tissue, and can be delivered often in an outpatient setting. Microsurgery may be a viable option when the tumor is large, greater than 2.5 centimeters, small, and preservation of hearing is possible. The patient is young and healthy. There are 3 basic microsurgical approaches. Translabyrinthine, preferred when there is no useful hearing to preserve and for large tumors. With this approach, the hearing nerve is severed. Retrosigmoid, suboccipital, typically has a 50-50 chance to preserve hearing. Middle fossa. This is preferred for small tumors and has the greatest chance to preserve hearing. ANA encourages the patient to actively participate in finding out which treatment option best suits their individual case, to take their time and carefully weigh each risk factor, and to seek more than one opinion. Support. Patients who engage the support of others report having a higher success rate, physically and emotionally. During diagnosis, they seek someone to accompany them as they visit the doctor, go in for surgery, and aid them in their recovery. Ginny Fickle-Air founded the ANA to bring people together, to help one another.
I think the thing that I am proudest of is the fact that today there is an organization in place to supply support and information to people who have been diagnosed with something that leaves them traumatized. They can talk face to face with others who have walked the same path and hear these magic, glorious words. I understand. I've been there. Tell me about it. Maybe I found something that can help with your problem. I didn't have that opportunity, and I'm glad I provided it for others.
ANA support groups educate and inform, nurture one another, reduce feelings of isolation, and provide emotional support. Help patients to develop realistic expectations and help patients adjust to changing life situations. Network to disseminate helpful tips for dealing with specific problems. From the Eastern North Carolina Support Group.
Sharing information is only part of our group's mission. Members of the support group get it. They understand the feeling of fear, frustration, and being overwhelmed at times. Our group's concrete symbol has been a cane, first used for post-surgical balance problems by one member, then passed from member to member as each person prepared for surgery.
ANA has a list of members who are willing to talk by telephone or communicate by email and share their experience one-on-one. Our newsletter provides in-depth articles written by professionals in the fields of neurosurgery, otolaryngology, psychology, and physical therapy. We sponsor a biennial symposium, which is an opportunity for patients, caregivers, and medical professionals to interact with one another through workshops and informal dialogue. Support is available online through the ANA Discussion Forum, where you can submit questions and receive answers to problems ranging from headaches to finding the best form of exercise. ANA supports ongoing research with updated patient surveys. The ANA website also has a link designed specifically for caregivers. For more information, contact Acoustic Neuroma Association.